And Matthew, it's launch.
Launch. It's the most fun. So what this is and pay attention, this is rapid fire. You see, I think it's 8 new companies launching today. First time they've been out from ramps, out of the garage, out of the apartments. They've put the cat and the dog away, and they're off for the first time. And it's always one of the most fun and interesting parts of Health 2.0. We've had some really great companies win this, some great companies actually not even win this. For instance, Castlight won it 1 year. Livongo was on launch, didn't win. Seemed to have done okay, though. So it comes and goes, you know. The folks who are now Apple Health, Devon's now a citizen, but the previous company, which is called Glimpse, became Apple Health, just came second. Anyway, but we're going to dive into it. Now, pay attention to all of these, because you're going to get to vote. We'll tell you how to vote at the end on your phone, but pay attention when we're going to get going. So let's sit down and get to it.
You're going to introduce the first company.
All right, so first off is Anchor Health. You've probably noticed that the core theme of this conference has been figuring out how do you deal with that new wave of patient consumers and how our industry is still kind of really struggling to figure out how to empower them. Anchor Health has developed a platform which champions the individual in navigating healthcare in a variety of ways, and I want to introduce you. This is Kash Kapadia. He's the founder and CEO to show us how it works.
Thank you, Matthew. Great to be here. By 2025, the US households are going to be spending over $1 trillion on healthcare directly out of pocket. And we've often heard these trillion numbers be spat out, but let's put that in context. That's the size of the federal budget deficit that we just hit last week. So this is an enormous amount of spend, and we're getting a raw deal. We've been talking about how essentially we struggle to get access to the right care. Our experience is abysmal, and it often feels like no one has our back. So with that in mind, I'm excited to present you Anchor Health, your champion in navigating healthcare. So let's take a quick look. So let me highlight a few ways in which Anchor Health champions you. First, we have a delightful conversational experience. It's secure. It blends the best of artificial and human intelligence. Let's take a look at how that works. Tell me about... Hello. Since most internet searches lead to cancer, let's get right to it. So you notice here that we have a conversational engine that then links into best-of-breed resources that are out there that we have vetted to be trusted and focused on creating a comprehensive journey for you across the silos of healthcare. So we put you at the center. We aggregate your health information. We go across care. We cut across medications. We go to mental health and include patient advocacy. Let's take one quick look at how medications work. Let's say you're prescribed a new fancy drug, and you'd like to know a little bit more about it. Right here within the app, you get information about the medication you've just been prescribed. And most importantly, through a partnership with GoodRx, we're able to present to you the cheapest place right near you where you can get that, along with the coupon, right here in our experience. So what you're seeing here is a theme of aligning the best of healthcare to make it work for you. Similarly, if we were to go with the same open partnership approach into mental health, I'm excited to say that we have guided meditations coming in from Headspace. Healthcare can be stressful. Sometimes you just need Andy to calm you down.
And welcome to Headspace on Reset. So no matter what's been going on throughout the rest of your day, just take a moment to pause.
On that note, there are times when a digital experience needs a human element to it to champion you. And in order for us to be able to fulfill our mission to champion you in navigating healthcare, we have partnered with Care Council, part of Stanford Healthcare, to bring their outstanding patient advocates to work on your behalf. So when you get a bill that you don't understand, or a claim that's denied and you're not sure why, or you need access to the right care, here's how easy it is to connect with them.
Good afternoon. Welcome to Anchor Health. My name is Sue. How may I help you?
Hi, Sue. This is Kash Kapadia. I'm a premium member of Anchor Health. I just got this bill. It's larger than I thought. I can't seem to make sense of it. I'm not sure if my insurance has been applied correctly. Can you help me with this?
Of course we can, Kash. We're actually experts in helping you manage the toughest challenges you have navigating your health care.
Thanks so much, Sue. Let me just get my papers together, and I'll give you a call right back.
Glad to help whenever you're available. Thank you.
Thanks so much. That's the pioneering patient advocacy organization in 1996. So today we're announcing an invitation-only private launch. The first 500 folks who request an invitation into our premium membership will get our premium membership for free. So please go to our website at anchor.health and request an invitation right now. We'd love to have you on board and together help us take back control of your healthcare.
Nicely done, Kash. So, and we have, in a bit of a departure for launch, for those of you who are experienced, we have like a one-question Q&A real quick. So here you go. You have, in one platform, you've brought together sort of chat that we understand, and then a bunch of different services. Obviously, you're new, so you probably don't have a lot of experience of rolling it out with the beta, but what's your sense, given your background at Stanford in the digital health world there, what's your sense about what's going to be the most useful piece? I mean, is this a direct-to-consumer play? Are you going to do this for our employers? Who are you going to focus on to get this off the ground?
Yeah, so we're putting the consumer at the heart of our experience. That's who we're championing. So we are direct-to-consumer. We're also B2B2C, but we're going through folks who would be willing to pay for a premium membership, for example, on behalf of the consumer. But pretty much the consumer is at the heart of all we do. We believe we're at an inflection point where the cost is just going to rise. I think that's been spoken about a lot at this conference, and that's the play for bringing it all together to optimize their transactions.
Fantastic. As Jane Sturson-Kahn just wrote, there's a lot of people thinking about health consuming, and that'll be the future. So congratulations. That was Anchor Health, Kash Kapadia, CEO. Thanks, Kash.
Thanks so much, everybody.
Our next presenter wants you to know that there is a vital sign that you should be measuring every day that will help you live longer, stay active, and independent for longer. Here to tell you about this new vital sign is Joshua Wies. He's board-certified geriatric specialist and a physical therapist and CEO of Agewell Biometrics. Agewell's mission is to end the epidemic of falls that affect 1 in 3 people over 65 years old worldwide each year. Agewell is here to launch Equilibrium, the first end-to-end fall prediction, detection, and prevention platform. Please welcome Joshua Wies.
Thank you. The equilibrium quotient, or EQ score for short, is a new vital sign that's used to measure fall risk in older adults. And falls in the elderly are a huge problem. And you can measure your blood pressure. Why can't you measure your balance, right? So at Agewell Biometrics, we developed the Equilibrium platform, which is for older adults and for the people that care for them. People like me. I'm a physical therapist, but I also have aging parents, and I worry about them. So Equilibrium helps you proactively manage and prevent falls. Very important. And all you need is an internet connection, a smartphone, or a smartwatch, and you can connect to our platform. Devices and services can also integrate with our analytics platform using our Equilibrium API. So on the launch screen here, you see that there's a home safety checklist, and there's a medication checklist, and these are things you can look into for risk factors that cause falls. And we can also go into physical function testing, and most falls occur during walking, and they're due to muscle weakness or due to imbalance. And imbalance is due to sedentary behavior, which is what you're all doing right now. So anyone who wants to get up, stretch your legs, feel free. So I'm going to go ahead and select Joe Bloggs here, and we can see his medical history has already been entered, and you can enter additional fall risk factors, such as dementia or dehydration. Any of these things affect fall risk. And we'll go ahead and into the physical testing function module now. So you accept terms and conditions, and we ask, if it's a practice test, then you don't save the data, otherwise you do. Did you have any falls since the last time? Very important. Did you exercise today? You might feel tired. How do you feel physically? How do you feel mentally? And these are validated for people with mild cognitive impairment, the emoticons. And then we'll go into the actual testing modules. Now your testing will begin, and we're going to look at a few different things real quickly. So sway is a physical parameter for static balance. You simply hold the phone against your body and stand still for 30 seconds. I won't make you watch me do that. But you can see the squiggly lines indicate that I'm gesticulating. And it's good for people with Parkinson's disease. People with diabetes who have numb feet will tend to wobble quite a bit. You can do the timed up and go test. And I'm going to actually simulate a vestibular disorder now. So the timed up and go test is something I do every day in my physical therapy practice. You start in sitting. Now I'm dizzy. You walk 10 feet. Thought I'd make this more interesting for you. You walk back, okay, and you sit down. And this is highly predictive of falls and indicative of physical function. So that's the tug test, timed up and go. And there's a whole menu of various tests you can do. Oh, I think I have time for one more quick one. This is the 5 times sit to stand test. And it's just like 3, get my workout, 4, 5, and we're done, okay? So I'm going to have a low EQ or score because I'm doing well. And gait is very important. We analyzed gait. I'll skip over these. Reaction time is very important. There's a whole menu of additional tests that you can do to bring out the nuances in fall risk, which I won't go into now. And if you messed up on any of the tests, you can retest those. And then you get your results in real time. So I have an EQ score of 17. I'm not going to fall, even though I spun in place. Thank you very much.
Thank you. So do you imagine this being kind of prescribed by a clinician, or do you imagine kind of patients self-managing with this?
It is a self-management tool. However, clinicians are using it. So the great thing is it's highly configurable. The system architecture is modular, so you can add and delete features. And it's designed with inclusive design principles so that older people can use it easily. Mm-hmm. But initially, clinicians are using it. So all of our pilot work has been in assisted living, home health care, and outpatient settings.
And will an elderly person need help from someone else while, I mean, you were able to hold it and do it, I thought, but I can imagine that being an issue. So how do you address that?
I mean, it certainly could be. And again, like, I want to stress it's like a vital sign. It really is your walking, your balance, these are all vital signs. And so people get on the scale every day, and they measure how much they weigh, they take their blood pressure, and older people can do that. So they can actually use smartphones, but if they can't, then a care provider, anyone can do it. The great thing is it's very simple to do, and it puts my expertise as a physical therapist into everyone's hands.
Yeah, fantastic. Thank you so much.
Thank you.
All right, moving right along. Next up, please welcome, this is Varun Goyal from Illuminate. So Illuminate Health is helping patients and caregivers with a medication self-administration tool that basically has an AI personalized medication schedule. It has a series of safety checks within it, and unlike some of the other medication schedules out there, it actually also connects back to clinicians. What Varun's also been doing with Illuminate is adding modules on the top. And the first one, you're going to see a glimpse of that today, is around substance use disorder, although there are others going to be coming up as well. They've already completed a successful hospital pilot, and we're going to have a look at the medication scheduler, the medication tool, as well as the addiction recovery piece today. So one last thing is that Varun, this is actually a pretty personal issue. So Varun, take it away.
Yes, it is. Thanks, Matthew. So my wife and I are fortunate enough to have kids now because we avoided taking a medication that was prescribed to us when we were pregnant, which could have resulted in a potential miscarriage. And now that's why I've made it my mission at Illuminate to be the digital care assistant to that family caregiver or the patient for safe medication administration. So let's dive into the Illuminate patient app. I'm going to start out by getting into the profile where the PHR aspect of it can be filled out from an EMR interface or from Apple Health. Obviously, you can set it up yourself as well. The one thing I do want to point out is the routine. So we capture the patient's routine in terms of what time do they wake up, what time do they go to bed, the meal times, which are all consequential when it comes to medication administration. So given what Matthew said, you know, how crucial safety is to the crux of everything we do, I'm going to illustrate by being a patient who was just discharged from, pick your hospital, from my heart condition. And now I was at the local urgent care
because I have a sinus infection. So it's prescribed an antibiotic, ciprofloxacin, which is commonly given for infections. And, I go through the process of, I've picked it up from the pharmacy. I know what it looks like. So from my pill organizer, I'll know exactly what to pick out. So I'm just going to pick one of these and then, enter how it was prescribed. What Illuminate's doing for me is doing proactive safety checks. And it seems like, it's found something here. It seems to be an interaction with my heart medication, warfarin. So I'm going to cancel out of here because I'm not really sure what I should be doing next. But luckily, I'm connected to my hospital that's been monitoring me, and they've caught the alert as well. And it seems like they've sent in an alternate prescription that I can go pick up. Alternately, if I didn't have that connection, an Illuminate Health pharmacist would be available to me, depending on the state. So we start out with Indiana, and we're, increasing our reach. And I'm sure, you can see on the screen, I'm connected to my dad as well. So a lot of us, being part of that sandwich generation, are helping our parents monitor meds apart from our children. So let's talk about that personalized daily medication schedule. We went to so many patient homes, and we saw how crucial it was for patients to know how and when to take meds, right? I mean, they got the pill organizers, tons of pill bottles. So let's illustrate that capability by adding a thyroid medication, levothyroxine. So just like a nurse at the hospital doesn't ask a patient what time of day you want to take the medication, neither does Illuminate. So going through that same workflow, we add a medication, and you'll notice that it's not asking me when I want to take it. And boom, now it's scheduled it at 6 a.m., which, if you remember back to my profile, that was my wake-up time. Levothyroxine is most effective if it's taken on an empty stomach, and that's why it's scheduled first thing in the morning when I wake up. So, and that's how most of the other medications have been scheduled. Zubsolv or, Suboxone are some of the medication-assisted treatments, the therapies that are being prescribed for opioid addiction. So those are also covered now. So let's switch gears to what Matthew mentioned, which is our, disease state module of addiction recovery, where a patient can come in and go through mindfulness-based meditations, look up an AA meeting or a SMART meeting that they can go attend and add to their schedule, apart from doing this engaging content to keep them on track with their recovery. All these content are recommended by addiction experts, and we have learning models in the background which continuously optimize what content is working best for one versus the other. So I welcome you to join me on our journey to help people with safe medication management. Thank you.
Thank you. So Varun, you've started here with you've created a pretty broad medication management schedule. It's got some nice features there, and you've added the one module you said so far. It's around substance abuse recovery. Mm-hmm. You've added into that things like addiction meditation. Meditation,
yeah.
Meditation.
Yeah.
Reaching AA meetings and the scheduling and that kind of stuff as well. Where do you go from here, and kind of what are the next categories of disease that you're going to add modules for, and where do you think you fit the balance between being a medication management platform versus an overall different type of disease management?
Yeah, and that's a great question, because when we looked at the different approaches to doing this, on the one hand, we're a really standalone product for the consumer, but really our philosophy is to be the extension of that caregiver, the provider. So we feel that the best way to get this app is to be prescribed. And we are starting out with substance use disorder, but then we've already got transplant patient management as our next IRB that was approved. And so we're working on that module.
And real quick, is there a back end for the clinicians to do? You didn't show it today, but it's a back end for clinicians we can do?
Absolutely. So what I didn't show as part of the demo today is the message that came to me from my hospital was really from a web portal that is part of the Illuminate platform. And so that's how they can do the monitoring in terms of compliance and patient-reported outcomes, as well as the communication.
And that's what happened so far in the substance use trial you've already done, is that right?
Correct.
Fantastic.
Yes.
All right, thank you very much.
Thank you.
Thank you. Great. Next, we have OMNY Health. OMNY provides a platform that empowers healthcare organizations with a secure, compliant, and frictionless means to share and monetize their non-HIPAA data. Acting as a contractual intermediary, OMNY opens up new possibilities for health systems to sell their data and create alternative revenue streams. Presenting for OMNY is Sunny Grewal, the co-founder and COO. Take it away, Sunny.
Thank you very much. Pleasure to be here. So some questions that we get asked are, how am I going to finance the construction of my new wing? Or, the salaries of 10 nurses that I've got to bring on because my volumes are increasing. Where is this money going to come from? How am I going to survive? Unfortunately, a lot of these questions are being asked today by healthcare providers all over the country, and cost cutting only goes so far. You cut enough fat until you start to cut into the bone and the muscle and the tissue of an actual health organizational structure, just to quote a physician that I spoke with earlier today. So that's where OMNY comes in. So at OMNY, we empower healthcare systems and providers to convert their operational data, which could be billing data or could be ERP data as an example, into recurring revenue streams by securely and compliantly monetizing it with third-party buyers. So I'll give you a case study. So we're going to walk through both sides of the platform. So I am a healthcare system CFO. I've already gone through OMNY's 2-week onboarding process, have shared with them some data. They've de-identified it. I've blessed it. It's now on the platform. And the first thing that I want to explain is our platform's underlying technology is distributed ledger. And so we talked about security, we talked about data governance in previous sessions. We really, really want to emphasize that. So one, all data is being held at a federal grade encryption at rest. But then secondly, you have full control over what gets placed in the marketplace. So here, me being the hospital administrator, I can confirm the data fields that I've placed into the marketplace. I can also choose to activate or deactivate my data product, right? So data governance here is very, very critical. It's very unlike the traditional broker model, which is, hey, I'll just give you a suitcase of cash and walk out with your data. Instead, this is empowering the health system. So additionally, the health systems and providers can also choose which buyers actually access and purchase their products, both by type, but then also by name. And so when providers or when buyers actually purchase the data, the revenues flow through OMNY and then to the healthcare system, which they can also manage with this nice little revenue dashboard that we've put up here, so you can manage how much money you've made through this partnership model with OMNY. The last thing on the healthcare system side before I switch over to the pharma side or the buyer side is that since these are revenue partnerships, there's no cap to your upside. So let's switch over to pharma or to the buyer. So why do buyers want this data? Well, I had to go in incognito mode, hope you guys don't mind, but the reason why is half of healthcare spend is actually within the four walls of a healthcare facility, right? But there's no direct visibility into what happens to that product. So questions like, how is my product being used by what types of physicians, for what reasons? I'd love to see that granularly. Unfortunately, that data is not readily accessible today, and buyers are willing to pay quite a bit of money for this. So just to show this how this worked for a buyer, you can see here the data is made available. We have a variety of data packages made available by our provider partners. I can quickly click on a data set. You can see here the pricing is very transparent. I can view my cart, add it, purchase it, and then once I've purchased it, I can then view my data, either in this nice little visualization, answering a lot of the questions that I mentioned previously, or I could download this, as a raw data file. So really, if you're working with a healthcare system or provider and looking to fund additional initiatives but are tired of cost cutting, please, find me after the conversation, after this discussion. We're lining up providers across the country on a daily, if not weekly basis. Thanks so much for your time.
Thank you. So who are you kind of putting out of business with this kind of product, right? Aren't there these intermediaries that are used to kind of going to health systems and saying, we can help you kind of sell your data to pharma? And is this sort of a threat to that kind of category of business?
The short answer is yes.
Yeah.
The reason why is, health systems today, and by health systems I mean like those that provide healthcare services, right? So systems, provider groups, what have you. They're being approached by these, the traditional model, which is, I'll just give you cash for your data and then walk away with it. And health systems, to their right, are very, very conservative, right? And they're like, whoa, I don't feel comfortable with that. So we want to make sure we put the health systems in the driver's seat about their data, right? And really empower them to think about a new business model where they can carry their businesses forward.
Yeah. And maybe go direct to that customer and negotiate
exactly.
that.
Yes.
How much heavy lifting do you have to do to get provider data ready to kind of put into your system? Is it pretty seamless?
It's pretty seamless. So we don't do any direct integrations with healthcare providers. We actually can do like SFTP as well. So we can onboard providers as quickly as 2 weeks. Mm-hmm. And then our sales cycles on the hospital side they're closer to 2 months now. from like full on start to data on the marketplace.
Do you take any revenue from the money they make, or is it just they pay you up front for it?
Oh, we take no money from the hospital or provider, so we charge nothing. So there's no cost to start with us. All we take is we take a share of the revenue that we generate from selling into buyers.
Okay, all right. Well, thanks so much for sharing.
Thank you guys so much.
All right, next up, this is going to be fun. Next up is Troy Bannister. He's the founder and CEO of Particle Health. So Particle Health, I'll tell you a bit about it, he's built an infrastructure which lets patients and consumers share their medical information with trusted solutions on the web without having to deal with patient logins at portals or direct integrations to hospitals. And for digital solutions, payers, other groups, anybody who needs medical data, Particle is a fast way to get connected and seamlessly integrate data within their own workflows. Have to point out that a little earlier in his career, Troy worked for our friends at Startup Health, and most importantly, I think 5 years ago, he was an intern at Health 2.0. So you can't go from an intern at Health 2.0 to being on the stage at launch. So Troy, show us Particle Health, please.
It's true. So let me ask a quick question. Who in this room's used Venmo before? Quick raise your hands, most of you. What you probably don't know is Venmo wouldn't be possible without another company called Plaid. And what Plaid did was they went around the country and partnered with all the banks, and they created a single API that allows you to take $5 from Bank of America and put it into your friend's bank account at Wells Fargo. And when we started thinking about nationwide interoperability, we took a page from this and decided, this is an interesting model to investigate. And about 2 years later, we are at today with about 90% of acute EHRs and about 60% of ambulatory EHRs, which is about 200 million patient records that we have access to do it just like Plaid does for companies like Venmo and other consumer applications, et cetera. So let's pretend for a minute that Matt last night sat on his phone and butt dialed an ambulance, which has probably happened. Typically, he would have to call his insurance company, get his medical reports, fax them in or mail them in, and wait 2 to 3 months to file a claim to get reimbursed for that ambulance call. But with Particle Health, we have a very different scenario. We're able to, with your permission, in the same way that we do fax today, expedite that process into less than a minute. And I'll show you kind of how we do it. So we partner with groups. It doesn't have to be insurance. It can be telemedicine. It can be pharmacies, direct to consumer. We don't really care what the solution is, just like Plaid doesn't care what Venmo does. And we allow you to enter in some information. So let's say he has a rash. Let us get your records. We're going to do 3 quick things. Confirm your details, since the insurance company already knows who you are. Review your rights, and consent and sign. So the insurance company already knows who Matt is. He's just signed in online. We have all his information. He's just confirming that it's correct. We read the same language that's on a paper-based HIPAA authorization form. Nothing changes. We click agree, and we sign Matt. Great. That's his actual signature. And in less than a minute, we've actually just searched across Epic, Cerner, Allscripts, Athena Health. About 90%. We have access to about 600,000 providers today in the United States. And we've just pulled a complete medical record, longitudinal, from about 10 years ago up to today, all aggregated together. And I'm showing you the entire record, but for the purpose of a claim, we would just pull that one episode. So it would just be the information required for that one claim to be processed, the proof of loss statement, the UB04 form, essentially. And so we're really excited about this because our mission here is to build a platform that allows new innovations to build on top of us. We have a free sandbox that allows any developer to come on and with synthetic data, start pulling fake medical records and building applications. We're super excited about this because it could mean anything. What kind of types of innovations? It'll debundle things from the hospital 4 walls into the consumer marketplace. We're also really affordable. So we give up to 100 real transactions for early stage developers, which means you can actually have 100 customers pulling records onto your application for free. After that, we start to charge you. And then we do a volume-based pricing after that. So really big insurance companies that have millions of transactions per month, every record that we pull gets cheaper and cheaper the more they pull. That's it from a high level. I'll stop there, and I'll answer some questions. Thank you.
So Troy, this looks kind of almost magical, right? Because we've had this promise, and in fact, I don't know how many sessions I've been in this conference, including the one we just had with Devin and Vince, Devin McGraw and Vince Garadas, talking about access to data.
Very relevant.
Very relevant across time. On the other hand, we've heard a lot also about FHIR and APIs from Don Rucker and how this stuff is coming anyway. Are you doing something magically different, or is this going to be, or are you tapping into a source that we don't know about? How are you able to get to so many plans and so many EHRs and so many different plans so quickly?
So essentially what we've done over the last 2 years is partner with what will be the QHINs of the United States, the Commonwealth's care qualities of the country, e-health exchanges of the country. And we've built in all the standards and protocols required to be a TEFCA on-ramp. So it's really, we've taken all that cost, cost us a lot of money and time, and we put it into a single API. And we just abstracted out. The same way kind of Redox does with one-to-one integrations with hospitals, we're doing the same type of abstraction with TEFCA QHINs. So you get access to the entire country versus a single hospital, and you just need a BAA with us as opposed to every hospital that you're pulling data from.
It sounds very clever. And the goal here is to sell this initially to other developers and other tools, and then have end-use consumers. So when I do dial the ambulance, I can sort out my own claim pretty much immediately.
That's the plan, yeah.
Fantastic. That's Troy Bannister with Particle Health.
Thank you.
Next up is Afsana Akhter. She's the co-founder of SkinIQ, which uses machine vision and AI to help people better manage their skin conditions, starting with acne. There are over 80 million people in the US that have acne, including 85% of all teenagers and young adults, many of whom are looking for treatment guidance. So SkinIQ's mobile app analyzes a user's skin via their camera and then classifies their acne in seconds, providing suitable products, treatment guidance, reminders, and tracking. Thank you, Afsana.
Thanks, Indu. Hi, everyone. Let's talk about Susie. Susie's a freshman in high school, and she's been struggling with acne for over a year now. And over the past few months, her acne's gotten worse to the point where she feels very self-conscious, and she's avoiding going to social events. Her parents are reluctant to take her to see a dermatologist. They're on a high deductible health plan, so it would cost them hundreds of dollars for the office visit and any prescription medications. But Susie is now armed with an iPhone that she got for her last birthday, and she's been searching online for solutions for her acne, and her search has brought her to an app called Clara by SkinIQ, and Susie sees that Clara offers a more technologically advanced way to help with acne and also a more personalized approach to her acne. So Susie downloads Clara by SkinIQ and gets started by answering a few simple questions. She indicates that she does have dry and sensitive skin, enters her age, and then using the camera module on her phone, the app will scan her face. All acne is not the same, and Susie doesn't really know exactly what kind of acne she has or which products to use. So Clara is going to scan her face. So the AI from SkinIQ is analyzing her skin and will determine what kind of acne she has and what severity of acne she has. And what SkinIQ tells her is that she has moderate comedonal acne. And also what SkinIQ will do is, based on her type of acne and her skin type, recommend specific products for Susie to use for best results for managing her acne. So these are the products that Clara by SkinIQ is recommended. Susie sees that these are dermatologist selected and they're known and trusted brands. She doesn't have to figure out how to go to the store to get these products. She can buy them directly on her phone and they'll get shipped to her home. And once they arrive, she will also get step-by-step instructions on how to use the products for best results. She'll get a morning routine and a nighttime routine, and she'll get reminders on a daily basis, encouraging her to stick with that routine. In addition, Susie can learn more about her type of acne, how acne happens, how the products work, and why her acne is different from other types of acne. And on a weekly basis, she can see how her acne is progressing. If her acne gets severe to the point where she does need prescription medications, SkinIQ can help set her up with a virtual visit with a dermatologist. And if she needs prescription medications, a digital pharmacy can help her get those medications. So this is how SkinIQ can offer a very personalized and convenient experience and help Susie and people like her regain their self-esteem and confidence.
So, Afsana, in terms of those product recommendations, what is SkinIQ's relationship to those companies? Are you kind of curating that through your AI and your own proprietary data, or are those spots available for, say, like, product endorsements, et cetera?
Yeah, it's a great question. So at the core, we believe that there are a lot of products available today. There probably isn't the need to create new products. And what we would like to provide at SkinIQ is a platform for those existing products to be best matched to the person and the type of acne. And it's a platform that could be used by existing pharmacies or new products. And yes, so our job would be to match the person and the acne to the products and then deliver it. The way we would charge for that is if we're doing the distribution, we would charge a margin on those products. Or if a large organization like CVS or Walgreens wants to do that distribution, they can license the platform and they can do the distribution. But we can do the product matching and use the AI to be very precise about which products and protocols should be recommended for each person.
Great. And then if you go into the virtual visit part of the phase you mentioned, will you also house that visit on the platform, or will you send them to sort of a separate company at that point?
Yeah, again, a great question. Plenty of telemedicine companies exist, teledermatology companies exist, so we at SkinIQ don't have to reinvent that wheel. In fact, if a health plan or a large employer uses this and they already have a relationship with the telemedicine vendor, we can just leverage that telemedicine vendor or digital pharmacy. So again, we want to be that platform that leverages existing services and products and distribution channels.
Thanks so much.
Sure.
Take care.
All right, well, launch is moving right along here. We only have two launchees left, so it's definitely a rapid-fire organization. And our next launchee is John Fox, the principal at Tidy Health. John's at pains to insist that you can always go back to school, even at the late age of 62. You said he went back and got an MBA, and then in that MBA, he focused on electronic health records, and he decided to come out and take on quite an industry. So Tidy Health has built a next-generation personal health record, makes it easy for families to store, share, retrieve, and their data, coordinate, and own all of their own information. And John's going to show us how it works.
Thank you, Matt. How many here have tried to keep their own personal health record? Then you know that capturing every aspect of your health care in one place is nearly impossible, unless maybe it's 1975 and you're at your family doctor. So how do we know that our health data is safe and secure when it's being shared by third parties? Tidy Health PHR solves both problems by letting you keep all your healthcare information in your own device and share it only with those you trust. Here my screen shows that your information is kept in 6 virtual folders, and there's also a reminder list. You can keep your entire family on your app. So today, let's follow my mom's quickly. Her health profile has her allergies and her medications and her conditions, and this can be shared with whoever and however you want to do it. No logins required. The active conditions are highlighted by red, and you can drill down and put as much or as little detail as you want, and you can also add files and photos. And if you want more information on the condition, such as fibromyalgia in this case, you can go right into the IBM Watson database without leaving the app. How cool is that? You can also schedule medication reminders with just a few taps. And they pop up on the screen, as well as the notification center. Let's go over to the Care Team folder. you will notice that it's a dedicated contact book, ready for telemedicine, that lets me contact any of Mom's providers. And if I want to set up an appointment reminder, that's very easy to do. I think I'll do that right now. And you can see it pops right up on her screen as well. It can also be shared with anybody that needs to know about her appointments. Mom had paper records that were about this thick. We scanned them all and put them in the tidy files. We call them tidy files because they can be expanded, shared, tagged, and searched for. Now, we don't have enough time to go through all these, but there's some unique features here. For example, the health log has a diary, a billing ledger, and a topic section where you can basically curate your own reference library of saved websites and apps. But you get the idea. It's pretty simple, really. Tidy Health treats your health information as a journey, a lifetime of care, and not as data in somebody else's EHR. So when you go to make decisions for yourself or your loved ones, you can do so with a feeling of confidence and in control. And isn't that what Health 2.0 is all about? So it's on the App Store now. Download it and use it well. Thank you.
Thank you.
John, fantastic. Very comprehensive in what you have in there. I have a micro question and a macro question for you. So the micro question is, you're entering your own data there. Do you have, and you can share it with your family members and others quite easy. That was very obvious. What about getting data from other sources? You've heard a lot about the different places where people get care, and obviously the different health records. We just saw Particle Health showing a version of that. How are you going about that part?
Well, we do not want push or pull the data into it. We want you to be in complete control. So you can upload any files that you want, CCDs or summaries, but we do not want the information coming in from outside.
Okay, so that's a self-control, and it's a pull system. The macro question is, on this stage last night, Chris Ross from Mayo said something along the lines, and I worked for one of these companies 20 years ago, that the road to health, to consumerism, is littered with dead PHR, the hulks of dead PHR companies. Why do you decide that you wanted to try another one?
Well, because as a physician, I go out there and I see what was available, and it's not much. Everybody sort of confirmed that this week. And Microsoft, of course, is no longer going to support their Health Vault. And Apple sort of went in a different direction with their health
product. Yep.
So basically, I think there's a huge gap there, and something as simple as this might actually plug it.
All right. That was John with Tidy Health. Thank you.
Thank you.
Thank you. So now, please welcome Jennifer Ernst. She's the CEO of Tivic Health, and she will demo ClearUp, which is an important bioelectronic medicine. This week, Tivic Health will begin shipping ClearUp Sinus Pain Relief, a game changer for the treatment of sinus pain from allergic rhinitis. It's a bioelectronic device, and ClearUp provides 40 million Americans with a simple, drug-free sinus pain solution. It's a clinically proven, FDA-cleared solution. It's available today without a prescription. Please welcome Jennifer Ernst, CEO of Tivic Health, who will demo ClearUp for us.
Thank you. As you heard, I'm here to talk about sinus pain. Now, statistically, about 1 in 5 of you in this room know exactly what I'm talking about. That pulsing, throbbing headache that just will not go away. It accounts for 7% of primary care visits. It's a bane to treat because really no pharmaceuticals do a good job. And in fact, it's a pain for the physicians as well as the patients. There has been no good treatment for this disease until now. I'd like you to meet ClearUp. This is an FDA-cleared, highly effective treatment and drug-free for sinus pain from allergic rhinitis. Michelle's been kind enough to demo for us today. What you'll see is that she glides the tip of the ClearUp unit across her cheek, gliding towards the nose, stops when she locates a treatment point, which is signaled by a vibration. When the vibration stops, she'll glide it to locate the next treatment point. So what are these treatment points? At Tivic Health, we have identified the electrical properties associated with nerves and vasculature that run through the sinus passages and out under the facial skin. We're able to locate those points with an adaptive algorithm, and we're able to stimulate them with a proprietary waveform. The frequencies we use in this device have been shown to elicit the production of norepinephrine in the sinus passages, fast-acting vasoconstrictor. So essentially, we're getting your body to make its own medicine. Clinically proven, double-blind randomized control trial at Stanford Sinus Center. 3 out of 4 patients achieved relief within 10 minutes. The effect lasted 6 hours after, and we only tested for 6 hours. In a 4-week study at home, patients reported improvements in both symptom severity and reduction in frequency of the symptoms as they used the product over time. We have demonstrated an efficacy level equivalent to the highest strength corticosteroids that you can buy over the counter. So let me recap. We have a fast-acting effect, fast-acting relief, we improve symptomology over time, and we have no significant side effects. There isn't a single pharmaceutical product that can make those claims. So we launched on Monday. ClearUp is now available on the Tivic Health website. By the end of the month, it will be available at Amazon. And by later in the fall, we will have it available on Walgreens, Best Buy, and CVS's online shops. Hopefully next year, you will be starting to see this over the counter at your local drugstore. So if you, someone you care for, maybe somebody whose care you administer, suffers from this debilitating affliction, I can't think of a better gift that you could offer them as we come to the end of the year than the gift of sinus pain relief. Thank you.
Thank you. So Jennifer, back to the data in terms of the number of patients, that it helps. Have you figured out if that's related to the severity of the pain, the folks that are helped by it versus those that aren't?
It's partially, you're going to see a much larger order of magnitude effect with larger pain signals to start from. So we're using, for example, a visual analog pain scale. It also, some of our responder, non-responder, it really focuses on that throbbing pressure sensation. Folks that came in who had more of a tension headache, for example, or something that radiated around the back of the head, we're not treating that because that's not really due to the inflammation in the sinus passages or the stretching of the nerve fibers. So the two mechanisms that work with a vasoconstriction, you basically constrict the membranes and can release some of the mechanical stress on the nerves. And we're stimulating branches of the trigeminal nerves. So the trigeminal nerves mediate the pain signaling, and we can start interrupting some of that. Mm-hmm. So improvement with symptoms over time, as well as that fast-acting effect.
Are you able to sort of reduce I wonder if there's studies that you're going to do studies looking at whether this reduces the onset of another, attack because you are actually doing some sort of physiological manipulation of the area.
Right. We haven't actually done the studies yet to be able to demonstrate that or claim it. But certainly if you get better drainage of the sinuses, which is what people will often report starting to swallow hard after they're using it. When you get that better drainage, you're going to improve sinus health in the general, you're going to be improving the overall sinus health.
Right, as opposed to just pain relief.
Exactly.
And I have one.
I just have one more question. So I guess my other question is, you've studied this for the nerve patterns around the sinuses, but are you imagining that could, you could learn about other nerve patterns and use this for pain and other indications, and what is that roadmap?
Absolutely. The FDA, well, just on this device alone, the FDA right now is reviewing our data on congestion to begin to add that to the label. Additionally, one of our advisors has used microcurrent in a very wide range of applications. So we have an exclusive license to her library of protocols. which ranges from fibromyalgia through sports injuries, and she has treated chronic rhinosinusitis with a microcurrent treatments. So we will be looking at, as the company grows, this is our first product, and I'm excited to have it in market after 3 years. But with this first product, we also see this platform for bioelectronic medicine. It really is an emerging area of medicine, and if you haven't heard of it, I think it's going to be the most exciting thing we have coming in medicine these days, is replacing pharmaceuticals with electrical stimulation, because the body is an electrochemical system, and we've been treating with chemistry for decades. Now we're starting to treat with the electrical side of the system.
Thanks very much.
I have one obvious question. How much does it cost?
Oh, $149.
$149.
Right, so there's $149 off our website.
Stocking stuffer.
Stocking stuffer. I can see it right now.
Exactly.
I'm going to go out
Thank
and
you.
get a sinus headache just so I can get one.
All
No, I
right.
won't. I'm kidding. Thank you very much.
Thank you.
All right. So that's the end of launch, and now you guys get to do the work of figuring out who's going to win. All right. So there's actually, I'm hopeful. Can we flip to the voting slide? There are some instructions. Okay. So please go to slido.com.
Okay, so we are going to close the voting now, and to help us announce the winner, we're going to bring out Kerry Amato, Executive Director of Health Innovation at HIMSS. Come on out, Kerry.
Hi.
So good to see you. Okay, so we've seen some great presentations today.
Amazing.
Tell them what this is all about.
So we're thrilled today to be giving not only a $5,000 monetary prize, but the winner will also receive a complimentary HIMSS membership, mentorship, and the addition, they'll get to present at HIMSS Global Conference in Orlando in March. So a nice prize package. We're
How,
excited
compared
to
to that nice piece of glass we gave them, they get all that.
yeah,
This is a definite upgrade.
It's
a life-size
This
check.
is an upgrade.
This is an upgrade. All right, so Kerry, you were backstage.
I was.
You want to tell us who the winner is?
And the winner is OMNY Health.
Wow.
Wow.
Woohoo!
All right.
Congratulations.
Hey, Sonny, congratulations.
Here, and we'll take a pic.
Sunny.
Can we get in the middle?
All right. Well,
Now we're being photoed.
okay.
I can grab the check and walk off with it. Is this a real check? Should I take it to the bank? Can I change my name to Launch?
Sure.
Can I change my name to Launch Winner?
There you go.
Thank
Congratulations.
you. Congratulations.
All right,
Thanks, Kerry.
Congratulations, Omni.